Hey, welcome back, everybody, to Telemedicine Talks. As always, this is Leah Damasco and your host, Phoebe Gutierrez. And today we have Dr. Haydee Docasar, a physician owner and a board certified OBGYN with 25 years of practice, currently located in Las Vegas, Nevada. Her work centers around general gynecology, perimenopause, and menopause care, and transgender hormone therapy. Three areas that she has watched transform from underserved specialities into some of the medicine's most consequential conversations. Dr. Dacsar, thank you so much for joining us and taking your time. We totally appreciate it.
Thank you.
Yeah, one thing I wanted to talk about, you've been practicing OBGYN for a while, right? And you were there in the transition. You saw telemedicine grow up, right? It's always been there. We've always talked about this. But during COVID, you saw it transform. And you were saying before we started recording how it transformed what you did in your practice as well. So can you go into a little of that and how that helped shape what you were doing and some of the seminars and how you incorporated that into what you're doing now?
So the reason I did my seminars, they were mostly hormonal, and I did especially transgender work before it was really, it was kind of, I'm saying, hiding. So it was really important for me to educate people. And the way I could do that easily was through my seminars. I used to do them actually live, meaning people would have to come to my office and participate in it. And then after it got popular to be able to do the Zooms and that sort of stuff, we transitioned into that. But initially for me, it was education. And I still do them on a monthly basis. And I think that especially hormones, if people are going to do them, they need to understand what they're doing and do it safely. And so for me, that's always been just really important. And even patients that I had that didn't want to do it, and I'd say, I really actually don't take care of people unless you do this. It's like my way of doing risk management, talking about benefits, all that kind of stuff. And after they do it, I'd say pretty much 100% of people were happy they did it and they found it very helpful to them. And so I've always enjoyed it. So I continue doing it.
Yeah. And these seminars, right? And you're reaching out to patients, doctors, both? How?
Everybody's invited, but in my
Yeah.
practice, if you're a patient, especially a new patient, I have you do that. Those are the beginning steps.
Really, that's interesting. That's interesting. And how have you seen your kind of practice change now that you've opened up into kind of this digital seminar space? Are you seeing, like you're saying, more people? Are you finding that more people are comfortable listening to this in the comfort of their own home? They don't have to go out and have what's the result been that now that you have this kind of method and this avenue?
Yeah, absolutely. Also, what I've noticed is family members, so they can
Oh,
participate. Before,
interesting.
had it in-house, people might not have been comfortable. Again, people are working, they're busy with life. So I'd really just get more the patients. Now I'm seeing, just like we were talking today, I'll see a mom or a dad or a brother who want to participate and they want to learn, especially even women with their husbands and vice versa, because I treat men as well. So I think it's just really given a big space. And I'm just very flexible. I don't really care. Whoever wants to participate, they can participate. So yeah, it's very interesting. I'd say, let's see, probably maybe 3 years ago, I would still have different seminars. So I had my females, I'd have my males, and then I'd have my transgender group. And now they're all together. I just do it all together. And I think that's really inviting to people because hormones are hormones. You do them differently depending who you're treating, of course, but their jobs are the same. So it's really interesting. They've all come into one group and I introduce it like that now. So even that's evolved for me a different way.
That's super interesting. I like the whole piece where, you know, medicine's always been about the patient, but traditionally it's been the patient, the person in front of you, right? And I like this idea of introducing or being able to introduce the social structure, the social support, especially in topics and the health topics like hormones, right? Sometimes, a lot of times, people do need social support, need their loved ones by them. And yeah, that's super interesting that you get family members in there too. Now, framing these seminars. Now, if somebody wants to start something like you have or have a certain idea, where do you start with this? Like, how do you frame it? Where do you begin?
It's really basic. I just tell them my starting line is always hormones are safe to do if they're done safely, right? So it's really important that, again, education's the number one thing, mostly because when you go wrong, for example, with hormones, it's either the physician who doesn't know really what they're doing, or it's the patient who chooses to do their own thing, but that's because they don't understand. So that's how I frame it. And most patients, again, they're pretty open to it. You'd be surprised.
Now, we're seeing a boom in hormone therapy, right? That's the hot new topic, right? And you see it everywhere. You see it everywhere. Nowadays, you see it where, hey, you jump on these big platforms, you just putting in information and poof, weeks later, you get hormones. And I think Phoebe, you had experience with this too, right? What should we be doing? Is that the right thing? Is that the wrong thing? What if people are looking for therapies like this? In your experience, how should they approach and what should they be looking for?
I think the number one thing is really finding a provider who honestly knows what they're doing, because you can harm people if you don't know what you're doing. And I see it. I'm not going to say as much as I used to, but I definitely see it. And then they come to me and I'm like, oh my gosh. And again, it's really not the patient's fault, I'd say. It's because they don't understand. And so I think it's really important to kind of let people know you need a provider who understands. And when I came to Vegas, I don't know, 23, 22, 23 years ago, my partner at the time, her and I were really the only ones that did any kind of hormone therapy in Vegas. And it was frowned upon. It really was. And we didn't have the information back then that we do now. And I've seen it just explode, but I also see it exploding where there are some providers. It's hard because they haven't had, number one, the experience, the training. Just because you're a doctor doesn't mean you should do that, right? Or you're a nurse practitioner, that I really think it takes years and years to learn. So for me, it's number one, get a good provider. Number two, for sure, educate yourself, because somebody could tell you to do something. And if you know better, you're like, oh, I know I shouldn't do that, because we're not home with them every day, right? We're not there to help them out. So they have to make sometimes their own decisions. And I hope it keeps going forward and not negatively, because I do think, especially, I don't care if you're a man, woman, transgender, if you need this in your life, again, if you do it properly, it's going to be a very positive thing. If you do it negatively, then that's where we get into trouble.
Yeah. What I'm curious your thoughts. So my experience with hormones, I think we did an episode about it. Nowadays, especially in women's health, it is now being touted as, oh, this miracle drug, right? Oh, you perimenopause is really hip and trendy. And it's almost like they're aggressively marketing hormone therapy to women. In your experience, what are some of the negative consequences that you've seen from a person who has, you know, gotten hormone therapy, but potentially didn't need it? And do you have any thoughts about just the telemedicine industry as it relates to overall hormone care? Almost this drive through, get a prescription. Everybody can have hormones. Because I'm with you. I think that hormone therapy is amazing. But I think, to your point, I think it's only good when it's done right and it's done under the right provider and it's done with the right education.
Yes, and that happens a lot. Hormones are not for everybody, number one. And I think that back to education, is that if people don't understand, especially when you're perimenopausal, it's a roller coaster and it's not going to be perfect. But that's part of the education, is understanding. We're just trying to lower that roller coaster, I think, instead of it being a big roller coaster. But the first thing is always, for me, and I talk about this in my seminar, is medical. Are you even a candidate? You may not be a candidate for lots of reasons, a family history, your own personal medical history. So that has to be looked at. And then everything that goes along with that. What's your lab work look like? How does your physical, what medical problems do you currently have? And what do we have to worry about for your future because of your family history? So they all tie in. And then once you get through that, and that's why drive-by hormones is not a good idea, because I've seen lots of people, they're not doing even physical exams on them. They have no blood work. They're not checking their levels, like nothing. And you have to have a plan, like a protocol for people. Otherwise, again, you're going to get into trouble. The exciting part, though, about some of this drive-by stuff is that at least women are being exposed and they are getting some education. And I think that's important because we've gone so long without that. I started my own personal voyage at the end of my 30s. It was miserable. Here I am. I'm an OBGYN. I don't operate anymore. I don't deliver babies. But back then I did everything. I even did plastic work. And so you go, and I was like, what is happening to me? So I thought, well, you help people with this every day. Why can't you help yourself? Really had to have some insight into that. And I think a lot of women are like that too, not just women, men, because men for a long time couldn't really admit the fact, I don't feel the same. I'm exhausted. I'm depressed. I'm gaining weight. I don't feel who I am. So the same thing that happens to women happens to men,
Yeah.
including the transgender group. So you hear, again, because they're just hormones, so you hear the same complaints throughout. So I hope that I'm seeing a lot of these, just as an example, these celebrities that are out there now talking about it. I think that's good just to get the word out, but getting the word out doesn't fix how people are going to do things. So
Yeah.
it'll get better.
Yeah. No, really interesting. I completely agree with you. I think at least women or women, men, I think that we're surfacing the hormone conversation. So I think people or consumers, patients, we're at the very least able to wrap our head around like the treatment and that there is a path forward. Whereas historically, I think it was a little more like gray. We didn't know what questions to ask when we would go to the doctors and so on and so forth. So I do think it's really interesting. And I do have a question. Many years ago, I got to work on the transgender policy for the state of California. I was a California regulator. And through that, I would do lots of different policy work. And it was really interesting to me because, again, I got to really understand the treatment pathway and how the different like step therapy and the whole process that one would technically go through. How did you get into transgender care? Because there are not a lot of providers in the United States that focus on it.
Honestly, it was fluky. At the time that I came into Vegas, I was actually getting my accreditation for functional medicine. So I was really getting into the hormones. And then again, on my website or word of mouth, it was just the word hormone. So they just started showing up at my practice. And I really, honestly, back then, we didn't have the guidelines that we do now. But I started just to learn about it. I really loved it, mostly because when I say that community didn't have a lot of places to go and get good care. And the most important thing for me, and I say this, I'm your physician, so I feel responsible. It's your health. And you mentioned earlier that, does everybody need hormone therapy? How do you know if you do? And because every hormone does a job, especially related to health, that's the important thing. Is this going to help you? Do you have a family? What's killing us these days is heart disease. Do you have a family history of that? Or with estrogen? Estrogen actually protects us until we hit menopause as women, and then our risk factors to men is equivalent. A lot of people don't think about that. And men, they make estrogen too, but lower levels. So their risks are always higher. So it's, again, knowing what these hormones do and how can we benefit them for your health.
Yeah. Yeah.
And
I completely agree.
Like a candidate or not. Is this going to help you in your health? And if it's not, maybe you need to stay away from it and maybe you shouldn't do it.
Yeah. No, I completely agree. I spoke with a cardiologist a couple weeks ago and she like terrified me in a good way. Not in a good way. She was really talking about To your point, heart disease kills like 1 in 3 women. And it's because of the hormonal decline and a lot of things. And again, I don't think people too often, I don't think we correlate that. Again, from a consumer's perspective, we don't
Right.
correlate them together, right? We go with our feelings, our symptoms. We just want to feel normal. But I also don't think we understand the biology internally of what is happening when these
Right.
shifts occur
Ab-
and how truly detrimental not seeking treatment could potentially be to you if, again, if it's something that you should be exploring. I think we need more providers like you that are, again, willing to dive into looking at your labs, looking at your symptoms, looking at kind of your whole health, and to your point, creating that real personalized plan versus just prescribing something because you might have a little brain fog.
And it's a choice, right? So if people want to do it or if they choose not to, but even as a physician, for example, I don't prescribe synthetic hormones. And I talk about
Mhm.
this at my semi-seminar because if you actually do look at the data, there's definitely higher risk of everything, cardiovascular, breast, la, la, la. And we don't see the same in the literature for the bioidenticals. So I kind of stay in a safety zone. My patients may or may not know that. Some of them do if I talk to them about it. Same thing when I do testosterone. I choose not to do it orally. Can you? Yes, but it can affect the liver. So I even make my own choices as a provider in what I'm willing to risk for my patient. So, some people say, why can't we do this? And then I give them my opinion. I'm here again to be your safety zone, keep you safe, keep you healthy, but yet give you some of the benefits that you can get. And that's kind of how I feel about it. So I don't know how a lot of other providers feel about it, but I'm in my bubble. I'm in the bubble,
Yeah.
especially since I'm not in the hospital like delivering or in the OR anymore. My bubble is very close. And what's interesting, because I was just talking to a patient about this recently, what I didn't have to deal with that I'm kind of dealing with now is social media. I mean, people are on their phones scrolling all the time. I have people come in and they're saying, look at this. And they send me stuff. I don't do social media really. I have some profiles, but I don't do them. And they'll show me and they'll send me all kinds of information. And I look into it because I think it's fascinating. And again, I want to learn, but I didn't have to deal with that before, and now I do. And I think there's a lot of misinformation too, to what you're talking about, Phoebe, is
Yeah.
there's a lot out there and it's just guiding them in a safe manner, basically.
Yeah, I completely agree. I think social media is really created. I think it's great, right? I always joke, I get tons of medical education from my Instagram feed. But I also think that the only reason that I know what's like BS versus what is legitimate is because
Mhm.
surrounded by physicians.
Mhm.
I'm always able to be like, I don't think that sounds accurate, and then verify it with a few different doctors. But I think that consumers don't have that same kind of, they don't understand. And so I
Right.
think social media has created this really interesting dynamic where you do have people, even people not medical professionals, giving medical advice on their own experience with this treatment and that treatment. I think that's where it is. It's this interesting slippery slope, I feel, with kind of like this new age of telemedicine, hormone therapy, all of that. Because again, to me, I was talking to a friend and he's a little younger and under 25. And he was talking about getting on testosterone therapy. And he was, I'm hearing all this stuff. And I'm like, but like, do you need it? Or do you just need to maybe eat some more protein and go to the gym a little bit more? You're so young. And then you look in the research and you're like, look, like it could potentially impact you for the rest of your life because of X, Y, and Z reason. And so to me, that's one of the things where I think like private practice concierge providers like yourself, like it really does make a huge difference. Again, because at the end of the day, I think hormones control just about everything in our body, and pulling in excess things unnecessarily could be harmful as well.
Absolutely.
Now, we were talking about your seminars, and before we run out of time, how do you find the seminars? How do they find you if they're interested in attending your seminars?
I say this mostly because I don't really advertise myself. And so I've been really fortunate, again, word of mouth. But if somebody, for example, goes to my website, there's there's a page there says I do seminars. If you'd like to sign up for them, then we get back to them. Or mostly it's a friend tells a friend and they call us, and then we just have to get them on the schedule because they need to get their invitations. Because again, the Zoom, I will have an average of anywhere from, I don't know, let's say 10 to sometimes 30, 35 people.
Oh, well.
So it's quite a bit. And, but again, what's nice is there's definitely people that hear it and they thought they wanted to do it. And they're like, yeah, no, that's not for me. So that's good too, because they're getting information that's helping them make a decision. But I've
Yeah.
never really, I've never really advertised and again, I don't do social media. I have these accounts. They're there, but I don't really use them. Yeah, and that's really it.
No, thank you. Thank you again for spending your time. It's super
Mhm.
interesting and definitely valuable hearing from somebody that has been in this industry, has been in this field of medicine for a while. Because yeah, it's not new, right? It's popping off and it's very popular right now. But to your point, it's super important to do it right and to find somebody that does. So thank you so much for your
Yeah,
time.
it's nice to meet
And
you
yeah,
guys.
nice to meet y'all. And to the listeners out there, thank you so much for listening. As always, drop us a line at info@telemedicinetalks.com, and we'll check you out next time. Thank you all.
Thank you.